Why Ayurveda doesn't just treat the uterus or the reproductive organs only. Sometimes, when patients come to me for infertility treatment for the first time, they get very puzzled that I'm asking questions about things like constipation, acidity, sleep, food, etc., instead of just focusing on the reproductive organs and talking about their uterus, ovaries, fallopian tube scans, and blood tests. Namaste and welcome. I am Dr. Anupama Santosh, your trusted Ayurvedic fertility expert. Today's topic is for every woman who's been told all your reports are normal, just keep trying and it'll work. And yet you have still not conceived, you're still not pregnant, you're frustrated, confused, and tired of not having answers. Here's what no one tells you. Around 30% of infertility cases have no obvious uterine or any structural or anatomical cause. Your uterus may be completely healthy, but your whole body system may not be in balance, may be out of balance. That's why in Ayurveda, we just don't treat the uterus. Of course, we treat the uterus if needed, but we treat you as a whole your body, mind, digestion, emotions, and energy as well. Let's talk about this very common myth. My scans are perfect. All blood tests are normal. So everything must be okay. But your body may be telling a different story altogether. Regular cycles, but scanty bleeding. You may have PMS, bloating, anxiety issues, low energy, poor sleep, brain fog, constipation, or low libido. These are not nothing. And you're also probably told that all these are not connected to your fertility. It has nothing to do with it. But trust me, these are signals of subtle imbalances that can directly affect your hormones, ovulation, as well as implantation potential. In Ayurveda, fertility is a reflection of the harmony, the whole body harmony, not just your uterus. That's why we look at Agni, which is your digestion, Ojas, which is your vitality, stress, sleep, and your emotional space, not just the lab values. Modern tests check structure like uterus, ovaries, tubes. Ayurveda checks that and the function of not just the reproductive organs, but your whole body to understand how well your tissues, hormones, digestion, and mind are working together. Here's what we assess. Okay, the manas, the mind, are there any stress or emotional blocks interfering with the hormonal flow? Your Agni, the digestive fire, are any nutrients being absorbed properly or efficiently to support healthy eggs and the hormones? And the Srutas, which are basically channels, subtle channels, are these subtly changing your reproductive pathways? Are they keeping it open and nourished or not? And then Shukra Dhatu is your reproductive tissue, egg quality, sperm quality, cervical fluid, etc., strong and well nourished. We see the body as an orchestra. Think of it, an orchestra with multiple instruments and vocal music. But if the other part, let's think of uterus as one instrument, but if the other instruments are out of tune, the whole song suffers, isn't it? Here's how we approach unexplained infertility when the reports are so called normal. Digestive reset, we strengthen digestion with Agni boosting herbs, warm food, and gut repair. Because if you can't digest, you can't nourish your hormones. Detox and rejuvenation, gentle detox along with Panchakarma to clear the ama, provide a perfect environment for getting pregnant, followed by Rasayana therapy to rebuild the ojas and the reproductive strength. Then cycle specific nutrition and herbs, the food and herbs that support your cycle phase by phase. And gritas or medicated ghees are always my choice of medicines and always personalized as per your prakriti. And a nervous system reset is absolutely necessary. We can use mind body practices, let's say like Bhramari, which is called a humming breath to release the mental tension, Ujjayi pranayama, which calms and centers you, and Jalandhara Bandha, which is a throat lock which stimulates hormonal pathways like thyroid because stress can shut down fertility more than we realize. Then a dinacharya, very simple practice, basically a daily rhythm of aligning your body's natural clock with sleep, meals, rest, and movement every day consistently at proper time, which builds consistency and hormonal stability over time. So, if your reports are normal but you're still not conceiving, don't lose hope. You need a whole body reset. After all, we are all born with a natural ability for conception. It's the nature's rule, law. Because in Ayurveda, fertility is not just about your uterus, it is about your entire being. If you know someone tired of hearing everything looks fine, share this reel with them. Follow our page and let's spread awareness. Let me know if there are any questions, or you can DM me your questions.